Welcome to our webcast, Improving Health Equity, Resources and Solutions, dedicated to sharing tools and resources across medical and healthcare organizations. I'm Barbara Lewis, and joining me today is Dr. Brooke Salzman, who will discuss the Antiracism Module funded by a generous grant from the Josiah Macy Jr. Foundation. Brooke wrote the section of the module titled Antiracist Approaches to Clinical Care. Brooke is a professor at Sidney Kimmel Medical College in the Department of Family and Community Medicine. She serves as co-director of the Jefferson Center for Interprofessional Practice and Education and as an associate provost for interprofessional practice and education at Thomas Jefferson University. Welcome, Brooke.
Hi, Barbara. Thanks so much for having me today.
Oh, it's great to have you here and talk about the free anti-racism module. So how did you get involved with the Josiah Macy Jr. Foundation grant to create this module?
Great question. Interestingly, in the past, the Jefferson Center for Interprofessional Practice and Education, what we call JSIPE, has had the privilege of collaborating with Dr. Dennis Novak and other colleagues at Drexel on online modules for the professional formation website, focusing on professionalism on interprofessional healthcare teams. Early in the process of applying for the Macy Foundation grant, Dr. Novak reached out to JSIPE to partner on this important project. The goal was to create anti-racism education through an interprofessional lens, making it relevant and inclusive for all health profession students and healthcare team members. After learning more about the project, I was excited to join, as I truly believe that dismantling racism in healthcare cannot happen in professional silos, with anti-racist education delivered separately for medical students, nursing students, pharmacy students, etc. It truly requires an integrated team-based approach where learners from different professions interact and learn with, from, and about each other. To me, an interprofessional approach is key to affecting change in our healthcare system. The delivery of equitable and inclusive care and services involves creating healthcare teams where all members feel that they belong, are respected and heard, and involves fostering an anti-racist culture in our health professions education and in our clinical environments.
So thank you very much for that background. And when you decided to join the group that was producing the module, there were 4 different sections and different groups, and they were content, assessment, faculty development, and curriculum guides. And you decided to join the content group. And I know that being involved with that group in meetings, that the first couple of months we spent actually talking about what the topic should be. And anti-racism covers a lot, but we had quite a few people in that group, I think at least 10 or 12, and all of them, including you, came to the table and said, here's what's missing, here's what the gap is. And we ultimately landed on 18 different topics that we wanted to explore. And I wanted to know why you picked this particular section, the anti-racist approaches to clinical care.
Well, both my roles as a family physician and a leader in interprofessional education brought me to this work and shaped my desire to really focus on anti-racist approaches to clinical care. As a family physician, I view it as essential to provide whole person care, understanding the broad context of our patients' lives, and recognizing the many factors that influence health, including the impact of racism. As a leader in interprofessional education, I see a strong connection between the competencies needed for effective interprofessional practice and those needed for anti-racism work. Both require attention to power dynamics and hierarchies, amplifying historically marginalized voices, and considering multiple perspectives, not just at the interpersonal level, but also within the structures, policies, and systems that shape healthcare environments.
So you have some personal experience, but I'm curious how you went about researching this section.
Well, I collaborated closely with two wonderful colleagues on this module, Dr. Beverly Crawford, Director of Student Engagement and Analytics, and Professor of Dentistry at Penn Dental Medicine, and Dr. Janice Thomas John, Assistant Dean for Integrated Medical Education and Associate Professor in the Department of Pediatrics at Albert Einstein College of Medicine. And given the breadth and depth of these topics, we focused on providing foundational information that we felt was hopefully practical, digestible, and relevant for learners across health professions. Our aim was to strike a balance between covering essential content and ensuring it was accessible and actionable.
It's great. Yes, and it certainly is. As one of the 18 different sections of the module. It's great. Uh, what surprised you about the research? Was there anything that you did that really surprised you?
I think, well, I guess to start with, in terms of what our section covered, several key areas. One is we focused on recognizing and addressing biases. We emphasize that clinicians are more likely to do harm when they deny their racial biases, and admitting and addressing bias is a critical step toward becoming anti-racist. We also focused the module on diversifying the healthcare workforce, how increasing representation is an effective strategy to improve access to care and reduce health disparities. We also focused on building interprofessional teamwork and communication, how team building is rooted in trust, mutual respect, and awareness of different perspectives. And this also involves recognizing existing hierarchies and intentionally amplifying marginalized voices. We focused on using interprofessional collaborative competencies to frame anti-racism strategies. So looking at these competencies to help foster mutual respect, understanding different professional roles, communicating effectively across teams and communities, and building inclusive patient-centered systems. And then we also focused on responding to racist patients. We explore how racist behavior by patients can harm providers and the critical need for organizations to have clear, substantive policies that protect staff and providers and foster safe, equitable care environments. So sorry, Barbara, you mentioned some of the things that surprised us in our research. I think two things stood out to me. One was the lack of substantive policies to protect healthcare workers from discrimination, even though we know discrimination happens frequently. And second is how siloed the efforts have been, where different professional organizations tend to take their own approaches to anti-racism rather than creating integrated interprofessional solutions.
That was surprising. Yes, and I should have asked you first what was included in the module. I'm glad that you added all of those sections that you worked on and that you included. Now, have you had a chance to use the module?
Yes, at Jefferson, we've used the module as part of a broader interprofessional anti-racism in health curriculum. So as part of that curriculum, we share resources across different colleges and programs to create a common foundation for anti-racism education, helping to weave, these principles more deeply into health professions training. So again, these modules have been instrumental in providing some of that content.
Mhm, mhm. So why do you think the anti-racism module is important?
I think the anti-racism module is important because it provides a structured, practical way for health professions learners and all members of the healthcare team to begin or continue their journey toward anti-racist practice. It emphasizes that anti-racism is a collective responsibility, one that requires us to learn together, reflect honestly, and act intentionally to change both personal behaviors and structural systems.
And hopefully that mission will be accomplished.
I hope so.
Is there any other information that you want to share with us today about your section or about the module in general?
I think I would just add that this important anti-racism work in healthcare isn't a one-time training or a checklist. It's really more of an ongoing commitment. It's
Mhm.
Yeah, just being willing to try to listen, learn, and challenge the systems that can harm patients and colleagues while building spaces where every member of the healthcare team and every patient is engaged and contributes in a meaningful way. So I've been really grateful to be a part of efforts like this module that help create space for this important work across all health professions.
Oh, thank you so much, Brooke. We really appreciate your working on the module. And thank you for joining us today on this webcast.
Thanks so much for having me.
You've been listening to Brooke Salzman talking about the free anti-racism module section that she wrote on anti-racist approaches to clinical care on our webcast, Improving Health Equity, Resources and Solutions. I'm Barbara Lewis. Thank you for listening.